had gone up like this. So it went all the way up like this, like she was trying to like get air. And then right when she did that, she stuck her tongue straight out, like stiff. And she almost looked like super shocked. So mom immediately grabbed the dog and put her in her lap, and she urinated all over mom. She looked very out of it, disoriented, shocked. The next day, we went to the primary vet, normal exam. They noticed absent pupillary responses on the left side.
Left?
On the left. That's why they recommended you coming to neuro.
So I took a look at her. She's very jumpy, right? So she's hard to kind of keep still, but she was very nice for her exam. No issues there. But I do see that that left pupil is a little bit larger, and it's not, constricting down as strongly as the right. It does a little bit. It's just not as brisk as the right side. So the question is always, is that a eyeball problem or is it a primary neurologic issue? I'm not convinced that is a primary neurologic issue just based on the event that you described, because it would be weird to have something affect those pathways with what you described. So as far as the kind of seizure event goes, the primary concerns would be, did she have a stroke event? I know she has a historic heart problem that's very stable. Her murmur is very soft. And according to Dr. Rupp's notes, it sounds like that's going to be something that should not progress with time. So that's good. She's been completely stable. She has had one event. Option one is we do absolutely nothing. We kind of ride it out. We wait to see how she does over the coming few weeks because there's no strong reason we have to rush into big tests that require anesthesia, especially with an underlying heart problem. Option two, for peace of mind, we go ahead and we do that MRI and we see, is there something actually there to explain this event, and do we need to be kind of more aggressive with treatment?
It was just a one-time event. I kind of think that she was in a stressful situation.
Yeah.
3 hours in the plane.
Yeah,
and she responded really quickly to fresh air.
So what we'll do is I'll write you a summary of everything that'll go to you and your primary, and we'll follow up next week just to see how she's doing. We'll just give you a call. If anything changes, you let us know.
Okay.
The other thing is she probably could use a bit of a fluid bolus, like a 5 ml per kg bolus.
We can start with that once we get an MRI.
Yeah, but feel free to give another dose of methadone.
No. Okay.
She might need it. Let's focus on what is going on in this dog's mid-back. Because see that mass? I'm gonna come down there. I see something that I don't like. So in the MRI right now, we have Ziggy, who is an 8-year-old spayed female miniature Pinscher mix who has been dealing with some ongoing kind of non-specific pain and discomfort over the course of a couple of months, honestly. So in the MRI, we have her, there was concern for a potential ruptured disc in her neck based on some x-rays that were taken. And she does in fact have that ruptured disc in her neck. So I can bring that MRI up here and we can see that this is between her 6th and 7th cervical vertebra. And this kind of black area, that bulge, that's that very chronic ruptured disc. And she has a very bright spot in her spinal cord, which tells me it's a chronic injury because this has basically been kind of banging up against her spinal cord as she moves her neck around over the course of likely several months. But more concerning actually on our exam or on our MRI study today is we're finding this very bright kind of abnormal region within the muscle next to her spine on both sides, and this is at her thoracolumbar junction, so right towards the end of her rib cage. So we're continuing to take some pictures of her spine to figure out what's going on here. We're going to be giving her a contrast agent, which will help kind of discern this pathology. So my worry is she also has some sort of kind of inflammation or even infection in the muscle. So we're going to be talking to the owners about doing some infectious disease testing and maybe even muscle biopsies to figure out what's going on with her. All right, we're gonna go all the way outside. So this is Mattie Mae. She's a 6-year-old spayed female dachshund that actually presented to us a couple of weeks ago for some hind limb weakness and pain, but she had already been put on medications by her primary veterinarian and she was doing pretty well. So we offered an MRI, but we elected to just kind of continue with a conservative approach, which she initially did well with, but then as the medications, particularly her prednisone, was tapered down, she started becoming symptomatic again, and she presented back to us this week for being even weaker than she was originally. So she could only take a couple of steps when she was walking, and then would collapse down on her hind limbs. We did do an MRI of her spine. Her exam had indicated a problem affecting kind of her mid-back region. The MRI revealed a herniated disc between her last 2 thoracic vertebrae, so that's T12 and T13. She went for a surgery right after MRI and has done really well. So now she's up and walking, wagging her tail. Come on, Maddie. Come on, Maggie. Maddie, come on. So walking very well, no more collapsing. Still a little bit wobbly in the back end, but overall doing quite well. So she's gonna go home this afternoon. There we go. So she's feeling much better, and hopefully this won't happen again for her.